3 years ago, sensational news spread through the world. Using infrared thermography, scientists discovered something really interesting, changes in temperature, and located mysterious voids in the base of the Great Egyptian Pyramid. As it turned out, the discovery created more questions than the answers. Welcome to the Health Wave. My name is Victoria Barayev. No, we are not going to talk about the Great Egyptian Pyramid. We will talk about medical thermography as the method for breast cancer screening and more. And in this long-awaited segment, I have two guests. The guest that's sitting right next to me is Tatiana Yefremova. She is a certified thermography technician, the founder and owner of Wellness Thermography. And we also have on the line with us Dr. Anthony Piana, fellow of the Professional Academy of Clinical Thermology. Dr. Piana, thank you for being with us on the line.
Thanks for having me.
Thank you so much.
I think you are in Phoenix, Arizona, somewhere in the United States. Is that correct?
That is correct. I'm doing my world tour, or at least my United States tour right now, spreading, teaching about thermography.
Oh, very interesting. Well, breast cancer screening is used to identify breast cancer in women who have no physical symptoms. However, there is currently much debate about which method of screening is best and how often women should be screened. At present, the most commonly used one is and recognized is mammography, which is also used in conjunction with ultrasound often. And we hear more and more about mammography not being so effective or even dangerous to our health. Yet, at the same time, thermography is becoming more and more popular. When we talk the word thermography, actually, it's not that quite simple because it brings a lot of confusion. So for us, the controversy behind thermography, for us, leaves us, general consumer, very confused. On one hand, they say thermography can pick up cancer before mammograms do. On the other hand, they say, no, it's not true. Thermography can miss cancerous cells, but yes, mammography can also miss cancerous cells. And we don't know what to think about this. Countries such as Japan, Korea, China, Brazil, Poland utilize thermography very extensively, while radiologists in Canada and New Zealand, they have been at war against thermography, and you can read all these articles in the online and the newspapers. So Dr. Piana, what is the procedure like? Is it a safe screening method?
Well, absolutely. It's completely safe because it involves no contact and no radiation whatsoever. So as far as a safety standpoint goes, it's completely safe.
How does thermography pick up cancer?
Okay, so first, in order to understand that, we have to understand what thermography is exactly. Okay, so thermography is a science of detecting temperature in objects, like you said, the pyramids, or in the human body, or for that matter. Okay, so it's a physiological test when it comes to the human body because we're looking at temperature differences in the body, perhaps right to left or from one time point to another for a baseline study. But what it does is, first off, everyone's familiar with thermography because what it is the same thing as an oral temperature. You take a thermometer, you put it under the mouth. It's the same that we've been using for many years now, checking global temperature of the human body. The only difference is we're using infrared technology to measure these little subtle temperature points on the body instead of just the whole temperature of the human body of 98.6 degrees or 37 degrees Fahrenheit. So we're looking at points in the body that would never show up on a global temperature difference, perhaps in the breast or other parts of the body. Infrared is very accurate. It's used in other sciences. I just did a visit in Texas, in Beaumont, Texas, with Gary Strahan from ICI infrared cameras, and he's making cameras for the Alaskan pipeline, for NASA, for bridges, for oil industry, electrical businesses. So when it comes to thermography, it's a safe and an exact science as far as that's concerned.
Very interesting. The history of thermography started in Canada, but Dr. Raymond Lawson, who first was, as far as I know, who was first reporting about thermography, Yet thermography isn't approved as a screening method in Canada. Is it approved in the United States?
It is. Dr. Lawson did a study in 1956 on 26 women, and what he found was 2.2 degrees difference in temperature from left to right in the 26 cases of women with cancer, and he published that in the journal. Okay, it's if you look on PubMed right now, you'll see that study, and there's more studies we'll talk about in a little bit. But yes, it's been cleared by the FDA since 1982. It's got its 510(k) clearance for breast cancer screening adjunctively, meaning in addition to something else. And we'll talk about that later too.
Can women rely on thermography solely as the breast cancer screening method?
No, not at all. I wouldn't rely personally on any one test solely, period. We'll talk about mammogram inaccuracies in a minute, but every test has its inaccuracies, let's say.
So thermography is approved as an addition to mammograms. Is that correct?
Yes, it's termed adjunctive screening for breast cancer screening in addition to something else. It doesn't have to be mammogram. Some people prefer to do ultrasounds along with thermography or MRI. But still, we're not trying to take people away from mammograms. That's up to you and your doctor to decide that. People come to us for thermography, and that's what we do.
So between all the available cancer screening methods, where's the place for a mammogram, sonogram, and thermography?
Okay, well, if we're looking at the mainstream, what's happening right now, the way we stand, it's mammogram is the screening, and then they follow up with certain other testings. And sometimes we get referrals from mainstream doctors for thermography as one of those follow-ups, but most of the time they follow up with either MRI or ultrasound. One of the things that and I know it's one of the things I wanted to talk about tonight, was the mammograms. What's happening after 35 years of testing, over 3 decades of testing. There was an article published in November 2012 in the New England Journal of Medicine showing that 1/3 of the cases that were treated from a mammogram finding were overdiagnosed and overtreated. Now, these overtreatments include anything from chemotherapy, mastectomy, or anything to that matter, including biopsy. So really, they have, I shouldn't say mammograms in general have their own inaccuracies, inadequacies, and there's been several studies showing that there's no mortality difference whether you went for a mammogram or you did not, as far as mortality of breast cancer is concerned. So really, I think everybody needs each other. I don't know if there's any one best method, but for example, we recommend combining thermography with ultrasound. We think that's a good marriage there of technology because one, you have the physiological test, which is the thermography, and the other is the anatomical test, which is the ultrasound. So you can see what's under there along with the temperature that it's radiating to see if there's anything that might be pathologic below.
So when they say physiological irregularities versus anatomical irregularities, can you explain that a little bit in more detail?
Absolutely. So a mammogram, people don't realize, is basically an X-ray machine. So it's taking an X-ray of the breast, sending radiation through one end, and in the old mammograms, it was a piece of film at the other end. Now it's a computerized plate that will detect any kind of densities in there. And they're looking for an anatomy, meaning something that is a lump or a bump or something that shows up that you can physically see. In fact, if you went in there and cut open the breast, you would actually see it there. Mm-hmm. So it's more like it's a structure where the physiology that we're talking about with thermography is heat that is given off from the body. So we're looking for heat that might be normal heat. Okay, a lot of times, well, not a lot, the body gives off normal heat, mm-hmm. but a lot of times there might be a fibrocyst inside the breast that's giving off a little bit of heat. So we'd have to kind of say, well, first off, number one, let's form a baseline. Is it the same temperature now as it is 6 months from now, a year from now? And if it's changing and going up, it's probably not a fibrocyst. It's probably something more serious like breast cancer. But we can also take ultrasound or a mammogram for that matter, and we can look at it anatomically and see what's under there at that moment. So we can see if it's a fluid-filled cyst, perhaps, or if it's something irregular and more dense, perhaps like breast cancer. So combining the technologies is always the way to go.
Great. Well, even though thermography has existed for almost as long as mammograms, as far as I know, it hasn't become as popular as the second one. Why is that?
Well, I think that what happens in the world of medicine is people jump on a bandwagon and they put all their marbles into one thing. They had a hard enough time convincing women to go for mammograms, and once they did, it snowballed and it got bigger and bigger to the point where I think it was in 2000 and I think it was 2008. The peak of women going for mammograms happened, and it was 65% of all women were going for those tests at that time. So it's really hard to convince people to do anything for their health. And when little problems come up, I think they have a tendency to get swept under the carpet. And when researchers like Dr. Gilbert Welsh come out from the Dartmouth Institute and show that this might not be the best test, or there might not even be a positive effect by going for a mammogram alone, I think they have a tendency, perhaps because there's so much money invested in the technology and equipment at the time. I'm sure billions of dollars have been spent on this, that they really don't want to just get rid of it. I think a bunch of radiologists would go out of business. So I think they're fighting for survival for their profession, number one, which is a sad comment in our society that happens, but it does. So what would happen if, for example, thermography code, like they did a large study. Let's say they validated it for us. We're working on that, but it takes millions and millions of dollars to get a study of clinical research size to be effective to show thermography should be a standalone screening or whatever it might be. That's going to put them all out of business. So what do they do at that point? I think that's part of the reason. And then, of course, there's politics. I think because a lot of alternative doctors have been doing thermography, including myself, like chiropractors. Honestly, I think there's this, problem with that for them, and they don't want that to be the case.
Yeah, I understand. We have a question that just came to us. Do medical insurances cover this procedure like they do with a mammogram? We will answer this question towards the end of the program. So, because I have more questions before that one, but we will definitely address this one. I wanted to tell you, I wanted to actually bring up the point that a lot of people who are not familiar with thermography will go and do some research online. And what do they see? They see that it says that thermography has a lot of drawbacks. And one of the biggest drawbacks of digital infrared imaging is that it has high false positive and high false negative rate. That's what the internet will tell you. And then the American College of Radiology doesn't endorse thermography for detecting clinically acute breast cancer. And then you'll see that there is a study published in 1990 that came out in the Journal of Epidemiology, was done on 10,000 women. And in that study, it says that 72%, about 72% of those women who developed breast cancer had normal thermogram results before. How can you comment on this one?
Okay, so it's a big question. So what I can say is I do agree, depending on the sensitivity that we're using to make our analysis, that there can be some false positives, okay? And of course, there's always false negatives in any type of study. In fact,
Sure.
mammograms, they estimate false negatives are 1 in 5 women with breast cancer is 1 in 5 due to the dense breast issue. So again, they have the same problem with false negatives, even more so than we do. So let me address false negatives in a second. As far as false positives are concerned, in my opinion, there's really not a false positive because we're identifying heat in the breast, and that's all the tool is meant to do. It's like a stethoscope is meant to listen to sounds, and it listens to a sound. Okay, we're looking for heat. If there's heat, it may not be breast cancer. It may be fibrocystic breast, or it might be an old injury. It could be anything. Okay, so we have to clinically correlate that information with other things and other testing, such as ultrasound or mammograms. Okay, so that's what the tool is meant to do, is find heat, and it does a great job of that almost 100% of the time. Mammograms, same thing. They're looking for densities. That's the job of a mammogram. It's not meant to diagnose breast cancer. Biopsy is the only thing to do that. Just as thermography is looking for heat, it's not meant to diagnose breast cancer. We use it as a tool in breast health and wellness, and in many cases, we find these cases of breast cancer. If you look at the Cornell study from 2008, it was done by the American Society of Breast Surgeons, and they found a 98% correlation between mammographic findings and thermographic findings. So they were pretty close with identifying cases of breast cancer. It identified 58 out of 60, I think, something like that, accurately. Okay. And as far as false negatives are concerned, there were a lot of false negatives in mammograms. And then I think it comes down to the definition. If you look at the 2012 New England Journal of Medicine article, 1/3 of the cases of breast cancer that they identified were not cases of breast cancer that would have had an effect on a woman's health at all. They were sequestered. Ductal carcinoma in situ and localized cancers were sequestered off, and pretty much with adhesions or scar tissue that don't become active. So in other words, we're not going to see those on thermography at all. Okay, those are 1/3 cases overdiagnosed because they're seeing the nodule, they're seeing the density with the X-ray, with the mammogram. Then they're biopsying it, they're breaking the capsule, and they're taking the cancer out, and then they're sending it to the lab, and the biopsy is saying it's cancer. Well, we're going to get called out on false negatives for that, but it depends on how you're looking at it. Truly, there was cancer in the breast. So if that's a false negative, that's fine. But what I think we're looking at with thermography are cases of breast cancer that are basically going to kill somebody. Okay, we're not looking at breast cancer that will allow a woman to live to her late 90s and without ever having expression of that cancer.
Mm-hmm. There's another question came, how often do you advise to do thermography? We will also answer this question very soon. But just to add to what you just said, you go online again and you see that modern medicine claims that there aren't really any studies to prove reliability of thermography. Is that so?
Not at all. If you go to the PubMed right now, you'll find over 800 articles on breast thermography. I think what they're talking about is we need some really large clinical studies in modern time. What most people don't realize is in the 60s, 70s, and 80s, mainstream doctors were doing breast thermography, not just in other countries, but in this country. Okay, the Albert Einstein School of Science and Medicine, I believe they had a case of 4,000 people they did. Johns Hopkins, if you look up PubMed, you'll see all the different studies. I don't have them all memorized, but including Cornell, this one in 2008. There are a lot of people currently looking at this to make it mainstream. It's just we have a very big obstacle with the way the system works to get anything new in there. And if I remember right, it took mammograms 25 years to get accepted. And that was there was a German guy in 1920 something who started mammography on cadavers, and it never became a mainstream screening tool until the 80s. So the same thing is happening with thermography.
There is another question that just came in. Is it true that as many as 1 in 5 mammographically detected breast cancers might never progress and some might even regress? Detecting such lesions 5 to 10 years earlier could only exacerbate the problem of overdiagnosis and overtreatment.
Yes, I would agree with that. I'm a thermography expert, and I'm going to talk about thermography, not outcomes of the cancer down the road. But I can tell you that there are cases where we'll monitor a patient with thermography year after year after year, and we'll see a spot on the breast that is normal, like the same thing exactly year after year, but then maybe 6 years later or more, that will start to develop into a hotter focal point of hyperthermia, and then we get that checked at that point, and it becomes they get it biopsied, and then we find out that it was breast cancer, and that same spot was there many years prior.
Mm-hmm. So what happens if I come and you see a spot like that you suspect cancer? Would you send a person to get a mammogram or an ultrasound done?
It depends on the breast density and a lot of other factors. Personally, I think for looking for focal points, if we see a point somewhere on the breast, I'd rather have an ultrasound performed, or perhaps even an MRI at that point, depending on the severity of it.
Mm-hmm. But avoiding mammogram.
No, not intentionally. It's just the fact that mammograms are a good diagnostic tool. I personally think, according to the study that I've read, many studies that I've read, that they're just not a very good screening tool. But that's my opinion. And I would say that if I'm going to choose a follow-up tool from thermography, independent of screening and the doctor's preference and the patient's preference for that, I personally would want to see what that looks like in an ultrasound right then and there.
Well, can I ask you to elaborate on your opinion of mammography?
Yes, I already talked to you about the studies from the New England Journal of Medicine, but the British Medical Journal also had one, very similar, again, showing no difference in mortality of those who went for a mammogram and those who did not. I believe the scientific community right now needs to really dig deep and look into that and find out new alternatives to breast testing. Because right now, if you look at the recommendations, it's basically 50 to 74 years of age, women without dense breasts, women without large breasts, women without small breasts, because these are all women who can't get tested accurately, obese women, and women with implants. So if you take all that out, that leaves women under 50, basically, and even some women over 50 with dense breasts and the other factors as well, that can't get tested. So that's, I don't know what the percentage is, but it's got to be more than half of the women in our society. So really, we need other methods of testing, and I think we need to dig deep and explore thermography, explore perhaps other types of ultrasound. Elastography is another option. There's some videos out there of other people talking about other technologies that are interesting as well as thermography.
What is elastography?
So I'm not an expert in that, but I can just tell you generally from what I've read, it tests the elasticity of the tissue in the breast. So a tumor is going to have a different elasticity than perhaps normal tissue. So if you compare it side by side like we do with thermography, you'll see that one might be less elastic than the other. Normal tissue might be more elastic than, say, a tissue with a tumor inside it.
Well, that's great that there are different tools available for us for breast cancer screening. Do hormonal changes affect the results of thermography?
Again, thermography
in the body.
I understand that. Yeah. So hormones affect everything in the body, from your skin temperature to women know that have had hot flashes. It's going to affect your physiology in many ways. So certainly, yes. We usually see these as a completely different effect than breast cancer. But sometimes, if you want to use the word false positive, which I don't like, we definitely follow baselines with that. And we'll see that the hormonal changes will fluctuate. If I did the test today, 2 weeks from now, it's going to be a little bit of a different fluctuation on those points. Whereas a breast cancer hotspot is going to just be consistent for the most part.
Mm-hmm. What do you recommend? How often should we get thermography? What are the guidelines for getting the procedure?
Well, as far as frequency goes, I believe that everyone should do it annually, okay? And some people, depending on your risk factors, even every 6 months, depending.
Mm-hmm. Is thermography used for other scanning other than breast cancer?
Yes. We're measuring the skin surface temperature of the body, so we're looking for temperature deviations anywhere in the body. And it's FDA cleared for 5 uses. I don't want to mess this one up, so I'm going to look at my notes. It's breast cancer screening, and it's all adjunctive, remember, in addition to something else. They're very clear about that. Thyroid screening, cerebrovascular screening, peripheral vascular disease, and neuromuscular disorders. In fact, the AMA actually came up with guidelines for the neuromuscular disorders back in 1987, and you could find that online, too, if you just Google it.
Mm-hmm. We know that most insurances and Medicare don't accept, do not cover thermography, right? What is the cost of the procedure?
I think I can answer that.
Depends where you go.
Yeah.
It depends on the location, just like any medical service,
Uh-huh.
okay? But I will say that insurances did cover it back in the 80s, okay? I think they took the code off the shelf in the 90s. So really, it was covered back in the day, but there are some other policies out there that will still cover, I'm told I actually have no experience in it. I don't do the billing, but I have heard that some insurance companies will pay for it, including HSA plans and that sort of thing.
I think Tatiana has something to
Yeah,
add.
I can answer the question about the cost of the procedures. Here in Atlanta, we charge for the breast health screening $250. Torso scan, which is almost like a full body, excluding the extremities, is $375, and the full body is $450. United Breast Cancer Foundation does cover. I mean, they don't cover, but they support thermography, and they'll pay up to $150. They give you the grant to use towards thermography. You can go on the website. Basically, the funds available each month, and you can apply, and then they give you pretty much fast the answer if you approved or not. So some of my patients did, use them, and it's a little bit of help.
I actually went on their website and I saw United Breast Cancer Foundation. You can fill out an application right online.
So you only pay, like, I think you pay $5 up front. That's the only requirement. And then it's income based, but they don't ask you to provide any income supporting documentation. It's basically questions and answers. And it takes about maybe 3-5 minutes to fill out the application. As I mentioned, a lot of my patients did use that resource to use the funds, and they provide the answers pretty fast.
And I think the next question is for both of you. You can go and see different thermography providers, mobile thermography and other places. How do you know when a thermography provider is not a reliable specialist?
Good question. Dr. Piana, do you want to go first on this one?
Yes, I think it's important to understand that we're working for a standard in the industry. I personally work. I'm the president of a nonprofit organization that we're extracting information from all over the world, from the former Soviet Union, from Brazil, from anywhere we could get information, even from the American Academy of Thermology from years ago, the articles that have been published. So we're putting all this information together. We have a nonprofit called the Professional Academy of Clinical Thermology, PACT, P-A-C-T. You could go there possibly as a resource. There are some other legitimate organizations out there, but you do have to be careful. There are some that are not using standards that are in line with the international standards that we're seeking.
Now, if people want to find you, Tatiana, where can they find you here in Atlanta?
They can call me directly. I'm not sure if it's okay to.
Yes, please. You can say the phone number.
The number is 404-254-9048, or go online and look up the website. It's thermography4you.com. Also, I wanted to add a little bit to the question if any company is reliable. From my personal experience, before I found Breast Thermography International, which is BTI, the company I'm associated with, I Googled, and the first company which came up, I did to this company and did the full body scan. So later I learned that company was using Meditherm software and cameras, and it appeared that they're kind of outdated and they don't use the best technology which is available these days. So the big difference, they don't provide inverse grayscale, and inverse grayscale is very important. Without having those images, it's very hard to see the full picture. So when in Breast Thermography International, we have 3-level review, which is another benefit. Like, it's not only one doctor, but 3 different doctors. And our senior doctor, unfortunately, Dr. Seppa was not able to join us today. He has PhD in oncology, gynecology, and thermology, and he has over 30 years of experience in all of these fields. So we have 3 levels of reviews, 3 sets of eyes look at the images, and so that's a big benefit. And also, as I mentioned, without looking at the inverse grayscale images, it's not a full picture. So if you're considering to do the thermography, I would ask to look at the sample report. If they don't provide you a sample report, so you don't know what you're gonna get at the end. You're gonna go get the screening, and then at the end, you don't know what you're gonna get, what you're paying for. So that's important.
So you get a very comprehensive report from the doctors.
Right. Yes, it's a 3-level review, and then the images are, first of all, our cameras, they're the latest technology cameras. It's very important that they are calibrated annually to make sure that they provide the highest quality. Also ask if equipment is calibrated annually, and ask for the sample report. I know one of the companies here in Atlanta, they offer It's a kind of trick, but Dr. Piana can fill in more into this. They have a trick. They have a cold stress, so they have a woman to put the hands in the cold water for about 1 minute. So they take images before, and then they have a cold stress. They have her put the hands in the cold water. So they're saying if you have cancer or precancer activity in the breast tissue, this cold stress will reveal if there is a cancer in there. But I don't think there is any scientific research to prove that. Dr. Piana,
Yeah,
can you?
let me answer that actually.
Yeah.
So years ago, everyone was doing cold stressing back in the 70s and 80s, because the theory was there is a lot of superficial heat on the breast. You'll see focal points of hyperthermia from hormones, from different reasons. And the theory was that if you cold stress the body, you would create a sympathetic response that would cool down the outside of the tissue, and only the deeper tissues would show up. Okay. And that is actually true. It's valid for the most part. Okay. The problem becomes when you do that, you talk about false negatives like we were talking before, that creates a lot of false negatives. So in other words, when you cool down with a sympathetic response and that hotspot goes away, it doesn't mean it's not breast cancer. Okay, so most organizations dropped that at least 10 years ago, if not more.
Great. Well, Dr. Piana, Tatiana, these were all of my questions about thermography. Is there anything that can be added to this?
I would just add that I hope with the future, people are smart enough to, question why things like this aren't included, not just thermography, but other forms of medicine. How can we improve our scientific, how do we get away from pharmaceutically based medicine? In other words, if there's not a huge profit in it, for some reason, we're not doing it in this country. So we need to, as a group, as a society, look at things such as nutritional products that nobody makes a fortune off of, or thermography, where a drug company is not going to get paid. We can implement these things into our medical mainstream system, but we need to question it.
Very, very good point, actually. Tatiana, do you have anything to add?
I think we've covered pretty much everything about thermography, how it works, and what kind of test it is.
Well, thank you so much. Thank you, Dr. Piana. Wishing you all the best in your traveling and in spreading the good message. Thank you
very much. Thanks for having me.
Thank you, Tatiana.
Thank you very much.
All the best.
Thank you so much.
Good luck, goodbye, and we'll see you next Thursday on the Health Wave.